Good afternoon, everybody. Hi, friends, boys and girls. I welcome you to this my presentation. I'm Dr. Aniket Mandrekar. I'm going to take you through this prevention measures to be taken before traveling, during traveling, and during stay abroad. Okay, at the outset, I must congratulate each one of you for securing an admission in the universities of your choices, right? And this is what the contents of the presentations would be. It would be about the presentation measures before your travel abroad, while you're traveling abroad. We'll talk about the medical kits, which is meant for the hostelers who will be staying in hostels or dormitories. We'll also be talking about the health hazard of staying in dorms and what are the solutions we can opt for. The reason for actually, this particular presentation is why your health is important when you're abroad, right? Because first of all, you'll be on your own and there will be nobody on whom you can fall back upon, right? So you will have to solve your own problems. And health is extremely important, right? Because the rest of the things you can buy, but not the health, right? So what I would just like to take you through regarding before traveling is the kind of anxiety you have, right, before leaving the country. And prior to that, you must be, must have undergone too much of running around here and there before securing your loan, securing your admission, etc., etc. So first and foremost thing about that, you must take good rest. You should exercise, take up an exercise, read about the country of your destination, try to know about the people, about their religion, about their cultural, priorities, and how these people view people from India, and about our race and religion and gender. I would also suggest you to undergo complete physical checkup, complete eye checkup at your ophthalmologist, complete dental checkups before you leave the country. You also should indulge into good nutrition and personal hygiene. Why I'm telling you? Because this is monsoon season in India, right? And you'll be traveling to the country where probably most of the time the semester starts in the September, right? And they are having summer this time, especially in the northern hemisphere, right? So you have to be extremely careful and not contracting any contagious diseases, especially the infectious gastrointestinal diseases. So what are the preventing measures to be taken? For that we will, in the due course, we'll discuss. While traveling, you should take good rest before you start your travel, and try to be hydrated because it is a long journey. Maybe you will be traveling to the United States or Australia or New Zealand, is a faraway places, right? And these are long haul flights, and especially the aircrafts are pressurized. So usually the human being tends to dehydrate, right? So if you get dehydrated, it's not a good sign. So stay hydrated. Keep on drinking a lot of fluids, water, juices, etc., etc. Right? And eat wisely and eat on time. Try to be physically active even within the aircraft. Because we have to also prevent the deep vein thrombosis from occurring. That means clotting in your deep vein of the lower extremities, your legs. So try to keep on moving, right? Moving in the aisle and keep yourself active, right? And I also would suggest you to pack a small first aid kit of over-the-counter medicines which are available without prescription, and it will help you deal with minor illnesses and emergency when you're abroad. So I tell you, okay. So what are the medical kit is meant for hostelers, right? Medical kit for hostelers are the people, students staying in dormitories, right? There are certain essential items which you can include, or there are certain items good to have in your medical kit, right? So what are the essential items you should have? Like thermometer, especially digital thermometer is better to carry when you're traveling. You can have some multivitamins with you, a small pouch of salt you can keep in the first aid kit so that you can gargle with the salt. Only the salt intake should be avoided if you're suffering from, more than normal excretion of calcium in your urine, or somebody who is already suffering from essential hypertension. right? Then take a small, eye wash glass. You can have tweezers, you can have cough lozenges, then you can have painkillers and other medications we'll talk about later. You can also carry heating pads or ice packs in your travel kit if the weight permits, of course. Small soup packages, sunscreen lotions, and lip balm. Coming to our health hazard, which are hidden in the college dormitories, or we call it hostels, right? Let's have a look here at the quote saying that living in a dorm room is like living in a petri dish. Petri dish is actually a dish in which the bacteria are cultured. So, why it is said so, because of the conditions so favorable for bacteria to grow there. Now, this is the first hazard I would like to bring to your notice, is that about the meningococcal meningitis. And meningitis is nothing but a inflammation of the covers of the brain. And this is extremely dangerous. Meningitis could be bacterial, could be viral, could be fungal. But especially I would like to bring to your notice about the meningococcal meningitis. This is extremely dangerous infection, right? It will appear like a flu, right? But especially these bacteria, they cultivate, they grow in the favorable conditions like dormitories or hostels. And these germs are passed through the saliva of the diseased person. But apart from that, if you know the fact that this meningococcus, or we call it Neisseria meningitidis, is a bacterial name, it resides in 15 to 20% of healthy people. They don't suffer from this disease, but they are carriers and they can infect others, right? And how do you transmit this disease? This is transmitted through your saliva, through kissing or sharing the glasses, for instance, right? And especially students living in dormitories have been shown to have almost maximum to 23-fold higher risk than those staying in other accommodations. And these are a few of the symptoms, which are triad of symptoms, which we call as fever, neck stiffness, and even altered mental status. But it's very difficult to diagnose in the first place, right? Why it is dangerous? It's a very serious infection because it can cause death within 24 hours. And despite the best of the antibiotics treatment, it is up to 40%. Who are affected by this disease can die. And those who survive, 11 to 19% of them remain with the complications such as hearing loss or neurological disability or even loss of limb. So this is a very serious disease. So what are the solutions? Solutions are, of course, you have to be preventive in terms of you always wash hands and wash hands frequently. Wipe down shared surfaces. Avoid close contact with someone who's sick. Eat healthy and get plenty of sleep, because deprivation of sleep will ultimately compromise your immunity, and immunity is your inborn ability to fight infections. And this is a vaccine preventable disease, so one must get vaccinated from this disease. And you know that there is in the United States the Advisory Committee on Immunization Practices. They have recommended the routine use of this meningococcal vaccine in 11 to 18 years of age. But any person between 2 and 55 years of age with an increased risk of contracting meningococcal disease, they have to be vaccinated. You know that increased risk of contracting meningococcal disease, I talked to you about the hostels and dormitories. Those who live in these hostels and dormitories, they are the ones who fall into this high risk category, right? And there are a few of the universities which have made it mandatory for all freshmen who enter the college to show a proof of vaccination in past 3 to 5 years. Now let me tell you, certain universities will not allow you to even enter the hostel or dorms, right, unless until you produce the certificate of vaccination, right? And it is always, of course, you can reach the United States or the country of your university and get vaccinated, but that is not the case, because you will not be protected from meningococcal meningitis that way. You have to take it, at least 3 weeks prior to your departure from the country of origin, right? So it would be ideal if you get yourself vaccinated from the designated vaccination center. And the important aspect about these designated vaccination centers which are close to your residence, we're going to flash it in the end of this presentation. So stay tuned, right? And some of the states, if you see, they also require proof of vaccination even before high school entries, not only colleges. So this is not only for the undergraduates, but even for the postgraduates. And I would suggest prevention is better than cure. And this is a vaccine preventable disease. In India, no one should at least die due to vaccine preventable diseases, I would suggest. So what are other vaccines recommended by IAP? IAP is Indian Association of Pediatrics for students traveling abroad. Meningococcal vaccine, MMR, that is measles, mumps and rubella, TDAP. I'll not go into the details of this. This information you'll get it from your designated vaccination centers. But remember, meningococcal vaccine number 1, right? And hepatitis B and varicella is for chicken pox. Coming to the next hazard, is again a very important hazard, that is HIV and substance abuse. And if you've seen in the United States, that if you've seen the youth between the age group of 13 and 24 are accounted for an estimated 26% of all new HIV infections, and 50% of all these youth aged 12 to 20 are reported to have alcohol abuse. 10% of the youth aged between 12 and 17 said they were current users of illicit drugs. Now, what happens with these people? Especially this substance abuse has been linked to HIV infection, which is transmitted through parenteral route or sexually transmitted, one of the sexually transmitted diseases, right? Because of both casual and chronic substance users are more likely to engage in high-risk behaviors such as sex without condom, or we call it unprotected sexual intercourse, when they are under the influence of drugs and alcohol. So friends, you must take care of yourself. The hazard, cold and flu. This is a hostel room is a perfect breeding ground for flu and common cold virus. Remember, these are viral infections, right? And they're highly contagious infections. According to CDC, or most reported cases of swine flu in 2009 were in the age group of 5 to 24 bracket, where there were 26.7 cases per 1 lakh people. Now, what is the solution? Hand washing has been proven to be very useful. Now, only in this particular case of viral flu, right, viral infections, say no to your hand sanitizers, because hand sanitizers do not take care of the viruses on your hands and fingers. So always wash your hands with foam, right? And the best part is flu vaccination is available. So flu vaccination is also recommended by CDC to all persons above 6 months of age. Only thing is you have to get vaccinated every year. The hazard, mold. Now, students actually need not worry about a little, mildew, or we call it the growth of the mold on the shower curtain, etc., etc. But you'd be very particular about the growth of this mold on the walls, right? And they're extremely hazardous to your health. Molds are nothing but fungus. Mold can be particularly problematic for those who suffer from allergic disorders like allergic bronchitis or bronchial asthma or other respiratory conditions. Now, what are the solutions for this? The mold thrives in warm, wet conditions. This is a favorable condition for these molds to grow. And so small-scale cases typically can be prevented by keeping your clothes, bathrooms and kitchen areas dry, or keep it properly ventilated. That is another solution to this. Coming to the next hazard is a binge drinking, and even the conditions for you are also favorable in certain aspects, like absence of parents, right? And that turn newly unleashed fresh pain, getting indulged into drinking, right? And drinking to excess is extremely dangerous and potentially fatal to your health, right? It has been shown that for every 5 drinks a student has per drinking occasion, his or her grade point average is lowered by half a grade. According to a paper published by impacting a research partnership at the University of Illinois and Chicago, this is the case. What is the solution? It is important to know your own limits, right? Of course, the handling alcohol depends and varies on size and weight and the ability of your liver to metabolize the ethanol, right? And to see the fact, it takes a liver 1 hour to process 1 drink, which is equivalent to roughly 120 ml of wine, 360 ml of beer, or 30 ml of hard drink. Coming to the next hazard is the bed bugs. We all know what are the bed bugs, right? So what is the solution for the bed bugs? And first and foremost thing about the bed bugs is avoiding used furniture and carefully checking luggage after traveling, right? Because to get rid of bed bugs is extremely difficult and it's very expensive as well. Sleep deprivation, I talked to you earlier about sleep deprivation, how it affects your immunity, right? You have to be extremely careful as far as your sleep is concerned. Get good night's sleep, right? And especially the students, they are notorious for pulling all-nighters to finish your papers and projects, etc., etc., etc. So try to establish a routine sleeping pattern, right? And abstain from long naps, or try to avoid coffee drinks or caffeine drinks or energy drinks or exercise at least for several hours prior to going to bed. This is something about the prescription drugs. I would say that the drugs abroad can be expensive, and we don't know what kind of medical system they might be having, right? So before you leave your own country, right, to your designated country, consult your doctor and visit the designated vaccination center as well. Get a doctor's signed prescription for any medication you have to take with you abroad. Remember that the prescription is a medical legal documentation and it makes legal only when the doctor signs it, right? So keep that original letter with you. Keep the copies with your family or friends. Keep one copy along with the medicines you're going to carry, right? And see that you carry all the medicines in their original packaging with the package inserts, right? Okay. And it's also advisable to carry an extra pair of glasses and take the prescription for your glasses or contact lenses as well. Coming to other medications, we call it OTC medications or other what we call over-the-counter medications. We do not require prescriptions since it is monsoon, right? The food and waterborne illnesses are rampant in India, and you see that 30% of all travelers suffer from diarrhea. You can always carry antidiarrheals like loperamide or Lomotil-like drugs. If you're allergic to something, get a prescription of antihistamine drugs like fexofenadine, which is a non-sedative anti-allergic drug. If somebody is suffering from for motion sickness, you must carry anti-motion sickness medication like Dramamine, or we call it dimenhydrinate, or also you can carry Avomine, which is available in India. Right? For fever or pain, you can always rely on paracetamol, which is a time-tested drug. Mild laxatives and stool softener can be carried to avoid any constipation because change in food habits and water. Right? You can carry milk of magnesia, or certain topical, or we call it local application creams like antifungal ointments or creams. You can carry clotrimazole, right? Creams which are available in India over the counter. That means you don't require a prescription. Or some antibacterial ointments or creams such as soframycin or neosporin. So friends, this is all. This is actually, I have come to the end of my presentation. Now I'm ready to take the questions. If you have any questions, of course, I'll be more than happy to answer those questions, and if it is in my capacity, of course. Yeah. There is questions here. I can take one of the questions. Let me tell. Should I carry with me for immigration check and for the university as well? I'm going to university now. What is this? Still how much time? Good afternoon, Sir Ravi Teja. Hi, sir. Sore throat, any prevention? Remember, I will take this particular question. Sore throats, any prevention? Remember, dear friends, if you are prone to pharyngitis, or we call it sore throat, try to avoid all possible cold and sour things, right? Try to avoid these things like ice cream, cold drinks, or try to stick to your, warm or hot drinks such as tea, coffee, right, and milk. Stick to that. And a regular gargling once in the morning and once in the evening is sufficient enough. And try to avoid the dusty areas. That's I would say. The OTC drugs require a prescription. Another question I would like to take is, OTC drugs are called as over-the-counter drugs, which do not require prescription. Now, you know that the difference between OTC abroad and in India is just like there's a difference. For example, there are certain drugs which are OTC abroad, but they are prescription drugs in India. So it is always better to check with your doctor, you know, which of the medicines will require prescription. Or even your next door chemist will be able to help you understand the difference between the two. So can I know what type of clothes should I take? Or oh, some children have already got vaccinated for, yes, but they should carry at least a certificate. Now this particular question I will take. Some children have already got vaccinated for meningitis but don't have the certificate. In that case, is necessary to take the vaccine again. I think this particular information you will be able to gather only through your designated vaccination center, and they will guide you properly. But I think if your child has already, or some children who have already got vaccinated, ideally within 5 years of time, that validity is of 5 years, right? If it is older than 5 years, it is better to retake this vaccination, that especially the meningococcal vaccination. I'm talking about meningococcal vaccination. Here nobody has mentioned it. Oh yeah, it is meningitis. One has to take it if it is beyond 5 years. If, the period has already beyond 5 years. And I would rather like to, as far as whatever questions regarding the vaccines you have, you can always go to your designated vaccination center and, get it clarified. And they will help you in all possible ways. And remember that there is a special actually offer through Credila for, the students through Credila on certain vaccines, especially on this meningococcal vaccine too. So I would rather suggest you better visit these vaccine centers. I am susceptible to the common cold. What precaution should I take? Okay. Also, in case I do catch a cold in the US, what recovery measures must be taken? Remember, dear friends, in medical parlance, we usually say common cold. There is no treatment as such, but you have to rehydrate yourself. If it is a flu, we say you take medicines, it will be gone within a week. But if you don't take medicine in flu, it will remain there for 7 days. So common cold is basically a viral infection, and viral infections are taken care of by your own immune system. So how you're going to improve your immunity, or rather, during that particular period, drink a lot of water, keep yourself hydrated, take good sleep, gargling, and you can take drugs like paracetamol for the body ache, or take antihistamine drugs if you have a itchy nose or itchy throat, right? And that's it. So you can have a symptomatic therapy, and I would rather suggest you better go to your local general practitioner who will also help you regarding this particular aspect as far as common cold is concerned. But you must keep on eating fruits, especially fruits which will provide you ascorbic acid, that is vitamin C. Yeah, and those who are want to prevent themselves from flu, there is a flu vaccine which is available, right? Only thing is that every year in the December you have to take this vaccine, right? And I would suggest that if you're prone to it and you fall in the high risk category, of course take vaccine. Let me check. There is a lot of questions regarding, I would just like to repeat that. What sort of prevention should I take in Canada? Now, remember, Canada is quite a cold country. I mean, if you go to the countries like Canada, North America, it is extremely cold there. The winters are extremely harsh. So you have to protect yourself from the winter. So you should be well dressed, especially cover your head, because that is the part which actually dissipates heat. And you have to keep your, body warm. So you cannot go out without a headgear. You have to have a woolen cap on your head, All right, keep yourself warm, use mittens, or and that's it. I mean, you have to keep yourself warm, keep hydrated, and have a good immunity. How many vaccines can we have at a time? Remember that, you know that when the child is born, and the child is when just 15 to 45 days old, the child receives vaccines, 5 vaccines at a time. There is a pentavaccine, right, called as pentaxin. So there are pentavalent vaccines. There are children at the age of 45 days can receive as many as 5 vaccines in one shot. So I think you're big enough to receive all kinds of vaccine, in one shot. Of course, but check with what vaccines go with, what. You better get connected with your designated vaccine center again. I would suggest that. And I think there is a facility which is available. You send an SMS. I think, I don't know whether you're able to see that. Are you able to see this particular facility? To avail this particular offer, which is, for the students of Credila, right? To get the nearest vaccine center, you can send an SMS to 56767, write VAC all capital space, then S space, write your name, space, and city. Right, I think you can see this. This is the last slide which I would like to keep projected here, so that you should be able to see this. Okay, is it all right? Have you taken a note of this, or you can get in touch with Credila, and they'll be able to tell you, or on their site. What else? What other questions? Similar questions we already discussed. Are there any special measures against the cold and snow and extreme? Remember, you have to dress yourself the way locals do. So extra care, especially keep yourself warm, and you will get acclimatized. No doubt, you're a human being, and and you're young boys and girls. I don't think you'll find it difficult to get acquainted with the climatic conditions, and no problem. Students. Okay, some students test positive for TB in the quantiferon test. The explanation doctors give over is that the BCG vaccination administered to us in childhood is yes, of course, in dormant state itself. This could be a problem for fulfilling the university's healthcare needs. Please explain. Now remember, friends, basically the diagnosis of tuberculosis is not serological, and we do test MON2 for that matter. It's just to get what is your immune status is all about as far as TB is concerned. Let me tell you, if you want to diagnose tuberculosis, there's a clinical diagnosis, but the confirmatory diagnosis, either you have to undergo polymerase chain reaction, we call it PCR technique, or the pathologist has to locate tuberculosis bacillus in the sputum, right? So I wouldn't take it. You better take a second opinion on this, please. And again, you check it with your designated vaccination center. I think they would be able to better explain this, right? Sudhanshu, I think I've answered that. Is it just one dose of quadrimeningo vaccine, or does it encompass multiple doses? Remember, dear friends, I think I have answered this question, but I would rather like to repeat this. The meningococcal vaccine, which is a conjugate vaccine, I think we have in India Menactra, and that is a quadrivalent vaccine which can be repeated. The booster dose can be repeated after 5 years. You can always get it done. I mean, there is a, for example, if my university has regarded a meningitis vaccine as a recommended one, however, it is not mandatory according to them. Should I still get it done? Remember, dear friends, it is a fatal disease. Siley, I'm trying to answer this question to you that although the university has not made it mandatory, but for your own sake, right? If you're going to stay in the hostel or dormitory, you fall under the high risk category, and prevention is always better. See, I would suggest that you better go for this vaccine, right? And don't even think about it. Like, for example, for rabies, whether the dog has rabies virus in the saliva or not, the doctor has to recommend rabies vaccination, right? Or pre-exposure, post-exposure, whatsoever. It is mandatory, right? And this is a fatal disease I've already spoken about. So better go to the designated vaccine center and they will really be happy to help you in that regard. Is there, Amit Pandey is asking, is there some specific strains required while vaccination against meningitis during traveling to abroad for study? Now, Amit, you know that this is a quadrivalent vaccine, right? And the most common strains which cause meningitis and they're endemic in nature are A, C, W, and Y. And all these strains are common pathogens to cause this meningococcal vaccine. And this quadrivalent vaccine will include all frequent pathogens known to cause meningococcal meningitis. Is there another question is there any specific format for certificate for meningococcal vaccination done in India? Remember, there are designated vaccination centers which are approved by your Credila. I think you visit these vaccination centers and all your queries related to your vaccinations will be sorted out and answered by these vaccine centers. And I think I would suggest, boys and girls, please get vaccinated, because nobody should actually suffer from the disease which is a vaccine preventable disease, and especially meningococcal, because I have seen only couple of patients suffering from meningococcal infection and all these cases did not survive. So I'm not trying to create a scare among you, but of course. What are the healthy food habits for students, especially for US bound students? Remember, this is Prashant asking this particular question. Remember, Prashant, you know what the healthy habit or healthy food habits is all about? It is about you should have a balanced diet and you should not skip your breakfast. Try to have cereals. In India, what happens is we are more towards carbohydrate. We are the only people on earth who eat aloo ki sabji along with chapatis. And these are both carbohydrates. This is imbalanced food, I would suggest. So try to balance your food. Healthy food habits in the sense, don't indulge into junk food. Junk food is okay once in a while or once in a blue moon, right? But try to inculcate good habits in the sense you stick to your timings when you have your breakfast. And breakfast is the utmost important meal of the day. Why? This is the only meal you can have it on time. Friends, and then we are left with only 5 minutes. I will take only the most important questions now. Are there any special measures against the cold and snow in extremely cold conditions? I have already answered that, I think, Suprita, right? Snow is, okay, cold and snow in extremely cold places like New York. Yeah, you have to protect yourself. You should be, dressed according to the weather. But you will get acclimatized and the local people will help you too, right? Is it mandated to get vaccinated while a student going for Australia and New Zealand? I don't know whether it is mandatory, but it is. You can check with your university, but it is always recommended. When especially the students, I'm talking about the high risk group. Now, what are the high risk group for meningococcal meningitis? It starts from infants. Infants are also they fall under high risk category group. Students living in hostel and dormitories, right? They are the high risk category, right? Third, patients who have suffered from maybe we call it the post-surgical condition, splenectomy. Now, for example, there is an organ called as spleen. If the spleen is removed, it's an immune organ, so their immunity is slightly compromised, or in such patients it is mandatory, and they fall in high risk category group. Okay, how many days gap should be there between vaccines? I took two last month, so when can I take another? No, you can take it anytime, no problem. There should not be any problem. There is no gap as such. Infants get it every 45 days. That means newly born child receives BCG vaccine on day 1 when the child is born, right? The child gets polio vaccine, oral polio vaccine. So I don't think there is any problem, right? You can always. And I think, friends, we are running short of time now. Is it okay, friends? Okay, I just close here. Wish you all the best, friends. And stay healthy. I would say I wish you all the best and wish you good health. Rest of the things you can buy. Bye-bye. Thank you.